Let's leave to me and you, babe. Let's go to Costa Rica. Let's leave to me and you, babe. Let's go to Costa Rica.
Okay, I'm sitting here with Dr. Prada at DDS Dental in Escazú, Costa Rica. How are you doing today, Dr. Prada?
Fine, thank you. How are you?
Good. Now, as everybody on the blog knows, this is my dentist, and a great dentist he is. And I just thought I'd sit down and ask you some questions that some people have been asking me. So we'll get right into it. First of all, Dr. Prada, what is your professional background, your history, and your training?
I'm a prosthodontist. I did my undergraduate degree here in the University of Costa Rica. Then I did what's called social service here in Costa Rica. We have to work for the government for a year. I was in private practice a little bit, and then I applied at LSU in New Orleans and was there for 2 years. Did my postgraduate prosthodontics and then came back to Costa Rica, and I've been in private practice since then. I teach in the university too. I teach undergrad dentistry and postgraduate in prosthodontics. It's a good program in Costa Rica now, so I'm teaching that program too. But most of the time, I'm like 90% of the time in private practice.
Excellent, excellent. Now, when a person contacts you regarding treatment plans, prices, and they're continually sending you emails with a lot of questions, does that become overwhelming to try to do your work and answer the questions, or maybe is some of that work allocated to a customer service person? Or
it's a lot of work, yes, but it's part of my job, and yeah, I have help here. I have an excellent patient services administrator that helps me a lot with that, with the initial contacts and many of that things. But when it gets technical, I answer the emails and all the questions and everything myself. And it's yeah, it takes time, but it's part of my job.
And your customer service person's name is
Maria Fernanda.
Yeah, and I've dealt with her many times, and she's excellent.
Yeah.
She's
good help, not only with the dental part, but with all the other part, hotels and where to stay and how to get here and how to do the whole thing. Many people are very confused on how to do that, and we give them several good options, different prices, how to be here, and to make it so much easier. Not only help with the dental part, but with the whole experience of coming here.
Right. Yeah. She helped me out on all kinds of aspects, like you said, hotel arrangements, where I was going to stay. So that was great. Now, is there something that a person can do when they're contacting you and asking you questions about treatment plans, prices? Is there something they can do to make everything go smoother? Something they can have ready and send to you so that there's as few steps as possible in order for you to get the information to them?
When the patient has gone to their local dentist and already have a treatment plan and x-rays and everything, and they already have a plan, it doesn't have to be at the end the plan, but it's at least an initial plan. It helps so much. There's some patients that would send me nothing, just some bad pictures with their phones, and that's not enough. I have a few bad teeth and this and that. I can't do much with that. Some people would come that way and just come here and we'll do all diagnosis and everything here, but the patient wouldn't have an idea of costs or treatment plan and time. So if they have x-rays and a treatment plan done by their dentist, we can follow that and quote based on that. We may think differently from the dentist and may save some teeth that the dentist decided to take out, or the other way around. But we have a good starting point that makes it so much easier and more predictable for the patient. I know it means for the patient spending some money back home doing this treatment plan and all that, but I think it's worth it.
Right, right. Now, what services are offered here at DDS Dental?
We're a group of specialists. We're all specialists here in the different areas of dentistry. So we're 7 people. So we offer all areas of dentistry. I'm a prosthodontist, which is the area of crowns, bridges, veneers, aesthetic parts, and the restoration of dental implants. We have an oral surgeon, a periodontist, which is a specialist in the gums, an endodontist, which is the specialist in root canals, pediatric dentist, orthodontist. So we have all the areas of dentistry we can cover in the same office.
Excellent. Now, are all treatments handled out of this clinic? Is there, like, if a patient needs x-rays, they have to go to another clinic, or is everything basically done here?
Everything is done here. Now we have a sophisticated equipment for the x-rays. It takes not only panoramic and cephalometric x-rays, but it takes 3D CT scan imaging, which is the best kind of x-rays you can have nowadays, so you know exactly how the bone looks like, either for implant placement or complicated root canals and all that. We have now this tool that is wonderful. And we have it here in the office.
Excellent. Now, do you have an opinion on in-house dental labs versus outside labs? Is there an advantage or disadvantage to one or the other?
Yeah, you know, in my experience, having the best dental technician in your office is very difficult. I know some people in the world that have accomplished that, but most people, you know, they get a good technician, and when it's very good, the technician leaves and goes somewhere else.
I've heard that. Yes.
So you know, I only want the best. So what I do is I choose the best from the technicians available, and I've been able to get the best technicians to work for me, but in their own labs. That I find that the best. Having the best technician for yourself rarely happens.
Right. Because once, like I said, once they get in here, then they want to start their own business,
That's right.
and they leave.
Exactly.
Correct. Yeah.
Yeah.
What advantage does a patient gain by deciding to use a prosthodontist such as yourself over a general dentist?
A prosthodontist or the different, you know, specialists in different areas, we do only that, and we were trained for several years to do this. That's all we study. We go to meetings, and that's all we do. So, I mean, if you're having heart surgery, will you go to a specialist on heart surgery, or will you go to your local family MD? So it's the same. If you want the same in dentistry, you need to get a specialist to do your work.
Excellent. I've been getting a lot of questions. A lot of people are stumbling on my website, my blog, and so they are contacting me, asking me a lot of questions. A question that I see that comes up often, they ask me if I know who the lowest priced dentist in Costa Rica is. Now, in my opinion, that's not a way to shop for a dentist. What is your opinion on that?
You know, it depends what you want. Usually you get what you pay for. You know, this applies not only for dentistry, but in general, everything in life. You get what you pay for. So if you want real cheap dentistry, you know, there's a lot of dental clinics that would offer that here in Costa Rica. But if you want the best in your mouth, you have to go to specialists. You know, some people will think a crown is a crown. You know, what's the difference? You know, this guy's making a crown, it costs so much, and this other guy's making a crown, it costs half. It's always a crown. No, it's not always a crown. The crown has to have the best fit. The tooth needs to be prepped right, so that you have this crown for many, many years. So you may get it for half price, and you may have to halfway have that crown remade. So at the end, it may be more expensive. But again, it depends what you're looking for. If you're looking for the best, or you're looking for, you know, cheap dentistry.
Right. And my next question, I think you kind of already touched on it, was what a patient would have to, if they did decide to go the cheapest route, some of the things they'd have to look for. But I think you just brought it up. You have to look for maybe those cheaper dentists using cheaper materials, cheaper implants, a cheaper type of, like I learned that there's different types of porcelain. You know, there's good porcelain, there's not so good porcelain out there. So
not only that, you know, you have to ask wherever you're going, is that dentist on the webpage, is he going to treat me, or is somebody else going to treat me? Because there are many places, you know, this big name, and they say this is this big specialist, a lot of experience and so on, and he has 10 general dentists. doing 95 or 98 or 100% of the treatment being done. So I would ask when you're asking for a clinic, is doctor such and such, is he going to do the work?
Yes, good question. Good question.
That's something that happens a lot. So, I would say you have to do your homework. What's the training of the dentist? Is he going to do it? The experience. There's also some well-trained dentists around, but they've been on the field for a couple of years or only a few years. Do you want experience too? So you have to do your homework, like I know you did when you came over. There's several good dentists in Costa Rica, very very good dentists, and there's very good bad dentistry too. Not only in Costa Rica, all over.
Yes.
In the U.S., in Mexico, in wherever you're looking for, there's good and bad. So you have to do your homework.
Yeah, I totally forgot about that point about you saying that. Make sure you know which dentist is performing the work, because during my research there was one clinic that it was just like that. The main dentist had a big name, but then after talking to a couple of their old patients, I found out that most of the work done was by people who they're maybe 1 or 2 years out of school, out of college, at a dental school.
That's part of the reason why it's cheap, because
right.
they pay these dentists cheap, and you get at the end a cheap or inexpensive dentistry.
Right. Now you stated that you got some formal training in the United States at LSU. How important is that for a dentist in San Jose, Costa Rica, to be able to put on their resume that you've had some training in America? Do you find that that North American patients, such as from USA and Canada, they react to that better, or does it really seem to matter?
I think it gives you a big degree of confidence. When you know this person has do their training in your own country, because there's other very good programs in all part of the world, but it's so difficult to know. How would you know if such a program in such a country, in wherever that is not in US or Canada? It's very difficult for you to know if this is good, serious training or bad. You would have a big degree of certainty if your dentist has studied in your own country.
Right. Now, what is your main advice to patients looking to come to Costa Rica for dental work?
Again, as we've spoke, making a little going back to what we've talked. First of all, if you've gone to your dentist and you have most of the information so you can send us, it makes it so much easier. After that, you have to look for the right person. We've talked plenty on that. You have to make your choice, and once you make your choice, you need to get help on staying in Costa Rica, which we or whoever you choose should help you on that sense too. So you're confident that you not only have covered the dental part, but you have covered all the you got good help to get around. I think that's pretty much. I think we've covered most of the advice we could give patients.
Right. And this is the last question, and this is probably the most important question. Who's your favorite patient of all time?
Yeah.
I didn't tell you I was going to ask you that one.
Do I have to answer that?
No, you don't have to answer that. All right, thank you very much, Dr. Prada.
Thank you.
Well, my seasons roll by high and low. I don't hold the reins, I ain't got control. And I wish my dice had a different role. And I wish my path were a ragged road, yeah. Let's leave to me and you, babe. Let's go to Costa Rica. Let's leave to me